You're listening to the We Are Libertarians Podcast Network. Find all of our shows at wearelibertarians.com. Welcome to Now Hear This. I'm your host, Chris Spangle. Now Hear This is a conversation with leaders in Indianapolis that are working to improve the lives of Hoosiers. Our goal is to empower you to join in their work and make a difference while informing you about the unseen aspects of life in Indiana. If you miss an episode, you can listen via podcast at nowhearthisindy.com. Today, we are talking about a subject that is very important to me, and you'll hear why. And it is something that is really troubling in the COVID area. And please take a listen and make sure you find places where you can help. We are talking to Kelly McBride, who is the executive director of the Domestic Violence Network. Their website is dvnconnect.org. Kelly, thank you so much for joining us, and tell us about the Domestic Violence Network.
Absolutely, Chris. Thanks so much for having me on today. I appreciate the opportunity to chat with you. So the Domestic Violence Network, or DVN, we're a nonprofit organization that has existed for over 20 years to bring community members of Central Indiana together to change the culture that leads to domestic violence. And we do this through advocacy, education, and collaboration. We're not a direct service provider, but we work with direct service providers to ensure that they receive best practice training and resources for their clients to ensure that they lead healthy and happy lives.
So you actually, in doing this research, you've just put out the State of Domestic Violence for Central Indiana 2018 and 2019, and I think it's important to look back and see where we were. So we'll start there before we can understand the difference of where we're at now. So can you tell us a little bit about the State of Domestic Violence for Central Indiana report?
Absolutely. So we released that last month in December of 2020, and it includes data from 2018 and 2019. And we collected it from various direct service providers as well as from the Indiana Coalition Against Domestic Violence. This is the first report that we published since 2016, and some of the findings that we've seen are just devastating, really. We saw that, and this is pre-COVID as well. So knowing that, we're in COVID now, these numbers are going to be even higher. What we do know from the 2018-2019 data is that there were more than 28,000 calls combined to 4 different agencies. And that the calls outweighed the capacity, with one agency saying that they had to turn away over 2,000 individuals over that 2-year time period. There are also over 7,000 arrests for domestic violence battery in that 2-year time period. And that's also an underreported number. We know that domestic violence and sexual assault are underreported crimes that happen. And these over 7,000 arrests were the individuals who felt the need to reach out to law enforcement. So that does not even represent the thousands more that did not reach out to law enforcement for help.
In my experience with friends that have gone through it, it often is they're unwilling to call because often maybe they've called in the past and didn't have a good experience with law enforcement. I mean, how underrepresented do you think that number might be?
Well, what we do know is 1 in 3 women and 1 in 7 men will experience domestic violence in their lifetime. And so that's 1 in 5 individuals will be impacted by domestic violence. So if we look at the population of Marion County, which is over 1 million people, we can estimate our numbers from that.
Yeah, so that's, let's say 300,000 versus the 7,000 calls that were actually made. That's
right.
That's very sad. So what else did you find in this report?
Yeah, we found that fatalities are increasing and that 65% of the fatalities were due to a firearm. I sit on the domestic violence fatality review team where we review all the domestic violence homicides that happen in Marion County. So I know from that team that only one of the homicides that used it legally. The rest of the time, the gun was obtained illegally. So that's concerning to us, that there are a lot of loopholes when it comes to gun laws. For COVID, we know that fatalities, so we had 75 fatalities, right? That increased by 85% in 2020.
What
So we
what
know that
what was the number this year?
we don't have the exact number at this point, but we do know from the Indiana Coalition Against Domestic Violence that it's an 85% increase so far
In
in
just
2020.
fatalities, not even just calls for
Right.
non-fatalities. Wow. Do you have any idea of
Yes.
the and I've had other organizations say we don't know because we haven't gathered the data on calls, but the only is the amount of increase of fatalities. That
We also know that there's been 125% increase in calls to IMPD that are domestic violence related since March of 2020.
wow.
So those are the two numbers that we have right now to go off of for COVID.
Is it that people are just, I mean, it seems obvious, but maybe you can pinpoint why do you think that this has increased?
Well, with COVID, we have a lot of stressors that are happening right now. So we have this beginning of COVID, we had the stay at home order. A lot of people lost their jobs. A lot of people turned to alcohol. Those are all indicators that can lead to domestic violence. So, yeah, I think those are the three main ones.
So I just think it's really important if somebody is listening and they maybe a family member or a friend that suspects that somebody is in a tough situation. It's a weird, hard position to be in because you don't want to make accusations, but I mean, what are some of the warning signs that people outside of these situations ought to look for, and how can they intervene in a way that protects the person that's in trouble?
Yes, Chris, that's a great question. Some of the warning signs to look for are if your friend or family member is being isolated by their partner, so they're not able to do the things that they once did. You're seeing controlling behavior, excessive checking up on them, whether that's through text messages or social media. Um, those are some key red flags. Obviously, if you see bruises on their bodies, that's another key red flag. Or having to talk on the phone or text message when their partner's not around. Those are things, especially during COVID, because you're not necessarily going to see those bruises since we're not in person right now with each other. So those are some things to look for. The main thing to remember as a friend or family member is you have to leave the door open for this person. They might not be willing to leave yet. It can take up to 7 times for someone to try to leave before they actually do leave. And to remember that it's their partner that's committing the crime by doing the abuse, not the person who's staying is not committing any crimes. So there's a lot of victim blaming that goes on with why do you stay? If he hit me, I would leave in a second. But you have to put yourself in their shoes and remember, like, they build a life with this person. They might have children in common. They might not be able to work or have lost their job due to COVID. So they have financial restrictions. There are numerous reasons why someone doesn't leave. So as a family member, keeping those in mind when you are confronting someone or talking to them, about the situation that they may be in, and being open and supportive of them for whatever they choose. So if they choose to stay, then talking to them about safety planning, and maybe that's having a code word. So if they are in a hostile relation or a hostile situation at that moment, and they can get to the phone and call you, they might say, hey, are we having peas for dinner? And that could offset the other person to know to call 911 because they're in an emergency situation. It's a tricky situation to be in if you're watching a loved one go through domestic violence.
And for the person that's in it, I mean, it's I think culturally it's clear cut when there's an act of violence. But I think we become more keenly aware of mental and emotional abuse and not just physical violence. I mean, so for someone that is wondering, am I in a situation that is bad, that is leading down a troubling road? What are some signs and symptoms that people ought to be watching for?
For mental and emotional abuse,
Right.
or anything that's not physical abuse, because that is clear cut, right? He
Right.
hits you, she hits you, that's domestic violence. One thing we know about a healthy relationship is your partner should support you and they should listen to you, and you should have a healthy relationship with them. So if your partner's putting you down, belittling you, not supportive of you, those are all warning signs and key signs that you might not be in a healthy relationship, and it could be a domestic violence relationship. Domestic violence is about power and control, and the abuser is going to use that power and control in whatever way they can. So that might be just, not just because it's very severe, but it could be mental and emotional abuse, or it could escalate to physical abuse. But domestic violence might not ever escalate to physical abuse. So that is something to keep in mind, that you could be in a toxic relationship and it might not be physical.
I'm going to ask an awkward question. I mean, I'm a Christian, but this is something that I run into a lot with friends, is the desire to not leave because they don't want to break up the marriage. They feel like they may not have grounds. I mean, have you run across that situation where for religious reasons people will stay in a situation, and how do you work through that with somebody?
Absolutely, people will stay in a relationship because of that. We've seen it time and time again. Individuals not wanting to leave because of their faith, and we have to encourage the survivor to do what's best for them and their family. Of course, I don't advocate for staying in a relationship by any means, but if they choose to stay, then we would suggest that they get individual counseling so that they can process what they're going through. We do not recommend joint counseling because the abuser can use what they learn in counseling against their victim after they're out of counseling. We don't recommend, pastor counseling or church counseling for the couples by any means, because again, he can use that information, or she can use that information against their victim. But safety planning is key if you're going to stay in a relationship. But also that God doesn't want you to be in a unhealthy, abusive relationship. That's not the principles of Christianity either. You are made in the eyes of God and Jesus, so you are a great human being and you deserve to be treated with respect.
So when somebody makes that decision to move on or to escape in a lot of situations, finances play into it so much, as you've mentioned, just the leap, the fear that comes out of it. What are those first steps that somebody goes through, and what resources are available in Central Indiana to help someone that wants to get out?
So to start with, lethality increases by 75% when you decide to leave a domestic violence relationship. So the 75% of the women who are killed by their partners have left. That is a staggering statistic. And because we know that, we recommend working with an advocate, because they can help you with the safety planning. They can help make sure that you have the documents in place that you need. Oftentimes people leave with just the clothes on their back. So keeping that in mind, working with an advocate is key. Resources available right now, our shelters are socially distanced and they're full. So that's discouraging. But at the same time, Lilly Endowment is so generous to our community and has just given Families First over $200,000 for hotel funds. So what this means is you can contact Families First at 317-634-6341 and speak with an advocate, and they can put you into a hotel and work with you on an exit plan. In addition to that, the Domestic Violence Network received $100,000 from Lilly Endowment, where we can help you with your first month's rent or a down payment to get you into safe and stable housing after you exit the hotel shelter. So there are resources. Our funders in the community are stepping up and really helping during this COVID situation and time.
One thing is, if somebody has had a bad experience reaching out for help, be it with, legal authority, government agencies, other organizations, I mean, do you recommend calling multiple agencies? Or if there's, you mentioned 2,000 beds weren't available, and that sounds like Lilly Endowment has helped with that. I mean, do you just keep calling till you get help?
Yeah, that's a frustrating thing to experience, right? If you finally have the courage to call someone for help and you don't receive it, I would definitely encourage you to call other people. And you can always call DVN and we can help you navigate that. Even though we're not direct service providers, we are trained in crisis intervention and can help you with resources. You can also call 211 and they can connect you. They'll know how many beds are available and that sort of thing. And again, Families First is phenomenal when they come to their advocacy. So they're always a great resource. But absolutely, that is very frustrating, especially if you're calling law enforcement and they're not very receptive to you.
Yeah, Family First is a great organization. We've had them on the program in the past, and they do so much good for the community. You are listening to Now Hear This, and I am your host, Chris Spangle. Please subscribe to our podcast now on your podcast app by searching for Now Hear This with Chris Spangle. I'm speaking to Kelly McBride, Executive Director for the Domestic Violence Network. Their website is dvnconnect.org. And let's talk about some of the programs. You have both an adult and a youth program. Let's start with the adult training program. What does that entail?
Our adult training program provides trainings. We have two different factors for this. So one is providing trainings to community members on how to recognize and respond to domestic violence. So community members are anyone in the community. It could be a church group, it could be a work group, it could be a sorority or fraternity. We do trainings with all of those people, and we do them for free. And right now we're doing them virtually. We also provide our advocates, which is anyone who stands against domestic violence and works in a professional capacity who might come in contact with domestic violence. We provide them with best practice trainings on how to work best with their clients. So that is our adult education. Our youth education is we go into middle and high schools and we educate young people on teen dating violence and healthy relationships. We know that teens, 1 in 3 teens will experience teen dating violence before they turn 18. So it's a very pervasive issue in our community and nationwide. And we have developed an all-inclusive curriculum to teach these young people.
So that's an important thing. I mean, most of my female and male friends that have experienced sexual or domestic violence, it happened in teenage years or in college or early 20s. How do you reach somebody if you're a parent of somebody who is a younger person? I mean, do you have resources available or know of resources that people can look up to really help them avoid falling into one of these relationships?
Mm-hmm. We do have resources available on our website, dvnconnect.org, or you can also go to Love is Respect and look at their resources. Our main resource is the Change Project, which is a 6-day curriculum that we provide to young people. We mostly do it in a school setting, but we could do it in a community setting as well if we had enough interest to do that. And we talk about healthy relationships, boundary setting, consent, social emotional learning, how to have a healthy relationship, and all those different factors.
So let's talk about your community-wide plan. What is the DVN community-wide plan?
Yeah, we just launched this a year ago before COVID hit, and we're really excited about it. It's called Equity, Listening to the Truth, Amplifying Voices, and Changing Systems. We are looking at 2 long neglected communities right now. We're looking at Black and African American women and the LGBTQ population. They are often left out of the conversation when it comes to domestic violence, and we both know that they disproportionately are affected by domestic violence more so than their white and cisgender counterparts.
By what order of magnitude? I mean, how much is the disparity? If you know.
For Black and African American women, it's 2.5 times higher, is what we know. For LGBTQ, we don't have the stats necessarily right in front of us, but we do know that they experience it at higher rates, especially Black trans women.
Can I ask why? I mean, have you pinpointed the reason?
I think that there's a lot of racism that goes along with it. There's also a lot of stigma. Especially being a member of the trans community, people are not accepting. And so they look at this individual, this person, and they see not a human being and a woman, but an object that they can, desecrate for their pleasure, which is unfortunate. But we see so many Black trans women who have been murdered and they're not being talked about in the community. That's the only thing I can really think of, is it's just not an accepted part of our society at this point.
I would also think that a distrust of authority for many reasons may play into it. I mean, are there specific organizations in Indianapolis that if, let's say someone is in let's say a Black trans woman is listening, is there an organization that wraps services around them to give them support?
For domestic violence specifically?
Yeah. Or in
no.
general, but specifically DV.
No, there's not. The Julian Center has rooms available for those who are trans. So there is help, but there's still, you're going to be living with other people. So there's still that stigma and that fear from others of the unknown, I guess. But for having we are opening as a community Trinity House, which is for young people of LGBTQ. And I believe it's 18 to 24 and they'll able to live there. So Jenny White's the executive director. She has a long history of domestic violence education. So I'm sure once that opens, that will be a great resource for this community.
So what other ways are you addressing social justice and applying that to the domestic violence field?
We're looking at our equity plan. And as I said, that has the intention and focus of looking at the intersection of being Black and African American and domestic violence, as well as the LGBTQ community. We have formed 2 task forces as part of this. And so we have one for LGBTQ. You have to be a member of that community to be able to participate. So we're elevating the voices of the LGBTQ community and listening to what they want when it comes to domestic violence intervention and prevention, because we don't know enough about it. Same when it comes to Black and African American women. We have a task force. You have to identify as Black or African American and be a woman to sit on that task force. And again, they are leading the way in what our goals and objectives are for this plan right now. So some of the things that they're looking at is they don't see themselves represented enough in brochures. And I mean, it's as simple as that, right?
Right. You have a designer and they go to the clip art and they're smiling white faces. And then,
right.
You don't understand the impact that may have on somebody who, they don't see themselves represented. I mean, that's nothing that I would have thought of as somebody who makes brochures sometimes. So that's really interesting.
Yeah.
The final program that I want to cover, because I just think that this is so key in kind of looking back, when you have somebody that has experienced gaslighting and cut off from friends and family and isolated and the lack of resources, government agencies, all these different agencies can be so hard to navigate for so many people, but especially people who are marginalized and in trouble. And they need an advocate a lot of times. I mean, it cannot be understated. So can you tell us about the Advocates Network and how that works?
Our Advocates Network is a vast network of individuals who are part of our network. We meet on the first Tuesday of every month. We provide best practice trainings, and then the advocates are able to talk with each other, because sometimes it's easier to get something done if you know the person than if you know the organization. So they're able to make those networking connections. People in our network are the traditional people you would think of: the Julian Center, Coburn Place, Families First. But then we also have social workers, the prosecutor's office, public defender's office, McBride. We work with Black Lives Matter on some topics. So there's lots of different entities that you wouldn't traditionally think of as domestic violence agencies that are a part of our network. As we said earlier, 1 in 3 women and 1 in 7 men will experience domestic violence. So these organizations and individuals are going to come in contact with victims of domestic violence. And everyone needs to know what the warning signs are so they can help.
Yeah, I mean, you reach out to a friend, and if that friend is involved, a lot of times people will reach out to somebody that appears well-connected, and if the people who are well-connected can connect with each other, they have somebody to call in their Rolodex. Has there been any discussion of or push into IMPD in helping train officers on how to deal with domestic violence situations? They're often the most dangerous situation for a police officer to walk into. Very highly charged, very dangerous for them. So it's a very tense situation. But, you know, I often hear anecdotal evidence of insensitivity. How do we talk with IMPD, and how can, because they're really the boots on the ground? I mean, what does that discussion look like here in the city?
Yeah, so the Domestic Violence Network and the Julian Center provide training to IMPD. We used to have this awesome program called Baker One, which identifies the offender early to prevent homicide and serious assault. The grant that funded that, we had lost it as a city. We just got it back, and we're in the process of revamping Baker One again. So the IMPD will be receiving training again on domestic violence, the sensitivities, the dangerousness of the situation. We'll be doing that in 2021 and 2022.
What about the police training center in Plainfield? I mean, it started the beginning. Has there been any discussion, maybe reaching out to them and expanding that to there, so every department around the state has access to that training?
Yeah, that's a bigger discussion than IMPD, but I do know that they receive 4 hours, which is ridiculously low, but they have 4 hours of training right now. And I do know the ICADV, the Indiana Coalition Against Domestic Violence, does go in and provide them some training, but that is something that we've always struggled to get in front of them to do more training, because 4 hours is not enough. Our advocates, we don't have a core 40 program, but sexual assault does. But our advocates, they get 40 hours of training, and IMPD gets 4.
Right.
So we definitely need to increase that. And as you said, it's the most dangerous besides pulling somebody over. It's the most dangerous call that they can go out on.
Yeah, I rode with a police officer in high school because I thought about becoming one, and they went on a call, and he said, "Man, the second you put your hands on the guy, she flips." You know, in more often than not. And so, you know, I'm not trying to beat up on the police. I really do think that more training in this area is something that ought to be done, and it would benefit police officers, it'd benefit victims, it'd benefit perpetrators. So, well, what is the one thing that you see, Kelly McBride, Executive Director of the Domestic Violence Network, every day in your work that you wish everybody could understand?
That even though, if you listen to this program in its entirety, all the stats that I gave are staggering. You know, the people who are being turned away, and the number of homicides that are occurring, but there is help available. It just looks a little different during COVID. People want to help. So reach out to 211 or Families First or the Julian Center if you are in a domestic violence relationship. Or I've even had people call me about a friend or a family member if you want to talk through that as well. And that there's resources available. So I don't want people to be discouraged when they hear about what's happening currently or in the recent past. People are here to help. We care. Our funders care. Lilly Endowment is this wonderful resource that we have in Central Indiana that no one else has. And they've stepped up, and they've really poured their resources into being able to help us further help others. Well,
thank you for what you do. I know that everybody that works in the domestic violence field, issues of sexual assault, domestic violence, it's very difficult work, and I've never met a group of people that are more caring and more motivated to help people. And thank you for what you do. I know it can't be easy.
Thank you. Thanks for having me on.
It's Kelly McBride, Executive Director of the Domestic Violence Network. Their website is dvnconnect.org. Thank you to her and her organization for coming on. Please make sure you go and support them at their website with a financial contribution, or get involved if they do you allow people to volunteer? Do you need volunteers in any way, or just you'd rather it be funded?
We don't really have a great need for volunteers right now during COVID, and we're not direct service, as we said. So we do have an event, Night with the Network, in October. We always look for volunteers for that. We didn't host it last year, but we will be this year. So if you are rather volunteer, I'd love to have you.
Great. Thank you, Kelly McBride. Thanks for listening to Now Hear This. I'm your host, Chris Spangle. If you missed any portion of our program, you can listen on our website, nowhearthisindy.com. If you'd like to have your organization featured on the show, please email Gabby at nowhearthisindy@iheartmedia.com. Thank you for listening, and we will be back again next weekend with Now Hear This.
Are you tired of wasting your time watching people argue about politics? Are you ready to learn how to take liberty-based solutions and bring them to your average person and get those ideas into action? Hi, my name is Brian Nichols, sales executive and host of The Brian Nichols Show. As a senior communications consultant in the greater telecommunications and cybersecurity sector, I've spent years working with C-level executives to help them future-proof their company's infrastructure for an uncertain future. At The Brian Nichols Show, I'm bringing my sales coaching and expertise to the Liberty movement. Why? Because instead of focusing on winning arguments, we're teaching the basic fundamentals of sales and marketing and how we can use them to win in the world of politics, teaching you how to meet people where they're at on the issues they care about. Subscribe to the program at briannicholsshow.com and find the show on your favorite podcast app. Again, that's briannicholsshow.com. And be sure to grab my free copy of my new ebook, 4 Easy Steps You Can Take to Sell Liberty to Friends and Family, right now while you're there. One more time, that's briannicholsshow.com.